This is Vamshi Krishna. So in this video we will see some of the basic questions. The first question is the vertical transmission of disease occurs through. The vertical transmission of disease occurs through. Options are droplets, mosquitoes, direct contact, placenta. So the right answer is option D. So option D is the placenta. So this is a vertical transmission. That is nothing but it is mother to fetus. Okay. So mother to fetus, any transmission, it can be barrier by the placenta. So it should be crossed through the placenta from mother to fetus. It is called vertical transmission. The right answer is option D. The next one is the surgical intervention for pain management, which involves cutting a nerve root to relieve a pain, is called. Options are cordotomy, rhizotomy, radiofrequency ablation, cryoanaesthesia. So which one would be the right answer? The B is the right answer. Rhizotomy. So rhizotomy is nothing but pain management, which is cutting the nerve root. So when the pain is present at the site of the body part, so the nerve which is supplied to the body part, it is cut. Okay, it is divided, otherwise cut. So the pain will be reduced. So this procedure is called rhizotomy. The right answer is option B. The next one is bleeding in the first trimester with no uterine contraction or pain and no dilatation of the cervix. It indicates. Options are threatened abortion, complete abortion, inevitable abortion, missed abortion. So what is the right answer? The A is the right answer. That is threatened abortion. So threatened abortion is nothing but the baby is died in the mother womb. Okay. So there is no uterine contractions or the pain, and there will not be have the any cervical dilatation. So it is called the threatened abortion. So the next one is the condition in which false beliefs are firmly maintained even though they are not shared by others is called. The options are delirium, hallucination, delusion, and illusion. So the right one is the option C, delusion. So delusion is nothing but it is a false belief. For example, it is a repeatedly hearing example, that is when the patient is psychiatric patient. So he saw a rope over the floor, but he is thinking that this rope is a snake. Okay, so this rope will be looking like a snake, but this is the actual name is the rope, but the patient is thinking that it is a snake. Okay, this is a common example. Commonly we will heard in the case of delusion. It is a false belief. The right one is option C, delusion. So hallucination is nothing but we are dreaming. Okay, dreaming. So we are thinking that it is going to be happen. Okay, so illusion is nothing but there is nothing, but they feel that there is a something. The right one is option C. The next one is the full form of DALY in the context of community health. So the options are disability adapted life years, disease adjusted life years, disability adjusted life years, disease adapted life years. So what will be the full form of DALY? The right one is option C, disability adjusted life years. So when the person is having a disability, it should be adjusted for the longer life. That is C. The next one is the third phase of body's adaptation to the stress. The right one is the options are reaction, exhaustion, resistance, beyond, rebound. Sorry, that is rebound. So what would be the right answer? Option B, exhaustion. So exhaustion is nothing but when the person is having a over stress and the body has some adaptation. Okay, it is called exhaustion. It is nothing but alasata. Okay, alasata. In Telugu it is called sorry, I can't write the Telugu. So this is exhaustion is nothing but alasata. The next one is, which of the following is not a role played by the nurse? Options are caregiver, communicator, counselor, physician. So it is a simple answer you can answer for this question, that is option D, physician. So the nurse cannot become a physician. Okay, so most of the people are thinking that the BSc nursing course can be equal to the MBBS doctor, but it is totally false belief. Okay, I am also thought like that before entering to the BSc nursing, but it is totally different and it is totally deviated from the nurse to the physician. So the nurse cannot play a role of physician. The next one is, which is not a high risk factor that might affect workers in a construction company? So here also we have the not. So always keep in remember not when you reading the question. So the options are traumatic injuries, malnutrition, chest disease, allergic disease. So which one is the right answer? Malnutrition. So malnutrition, it cannot affect the nurses or the workers who are working in the construction company. But when they are working in the construction company, they may have the traumatic injuries, otherwise fractures, head injuries, and like that, and chest disease. So chest disease nothing but lung diseases. Okay, lung disorders. And the next one is the allergic disorders. Allergic disorders can be occurred by the working in chemical factories. Okay, but the workers will not get the malnutrition unless they don't have interest to eat much food. The next one is, the action of the sympathetic nervous system in the walls of the airways is called. So options are bronchoconstriction, increased secretion, increased gas exchange, bronchodilation. So what may be the action of sympathetic nervous system in the airway? So which one is the right answer? Option D, bronchodilation. So bronchodilation can be occurred by the sympathetic nervous system. So the right answer is option D. So the next one is the total number of fetal and early neonatal deaths per 100 live birth is called. Options are fetal death, perinatal mortality, intrauterine death, neonatal death. So what would be the right answer? Option B, perinatal mortality. So perinatal mortality is nothing but the baby is died in the mother womb. Okay. Otherwise, early neonatal death after the delivery of the baby. So it is perinatal mortality. It can be analyzed by the 100 live birth. Okay, 100 live births. The next one is repeated involuntary or intentional passage of feces by a child in inappropriate place after the age when bowel control is normally expected. The options are night sweats, enuresis, nightmares, encopresis. So the right one is option D, encopresis. Encopresis is nothing but uncontrolled feces. Okay, feces. And nightmares are the bad or scaring dreams. So enuresis is nothing but urine in the bedtime. Night sweats are nothing but some kind of fear. It leads to the sweating. So the right one is option D, encopresis. So the last one is the proton pump in stomach is an example. So among these four options, which one would be the a proton pump? Options are secondary active transport, simple diffusion, primary active transport, facilitated diffusion. So what is the right answer? Option C, primary active transport. So it is an example of proton pump in the stomach. So this is end of my class. Thank you for watching.